I can remember one client who basically would determine where she was going based on the averages. And she had acquired a very high cost, no profit organization. And she would use the statistics, the tools to manage, bring her business into control and to manage it. So once her costs were in line, she then used the internal cost reporting to help her guide her month in and month out spending so that she wasn't off target, either underspending or overspending. And there were very few incentives back in those days, in the mid-'80s, as far as, quote, profitability, and those were in the I'll say the administrative area, the plant area. So she became well known.
She was an incredibly disciplined operator, incredibly. And she lived by the findings in that cost comparison and her rate computations, which we did for her every single month, faithfully and religiously. I can recall, John, you met with her at least once a month, and I want to say there were periods when it was once a week when you or someone from our team was meeting with her. She was just a faithful operator. It was by the book. And yet every person in her facility loved her, and everyone in the community loved her because she was fair and transparent. Pretty remarkable, actually.
I mean, I remember sitting with one client, and they were 3 times the average in one category, and kind of going, how can we be that far off? They had no idea that they were that far off from the average. And 6 or 7 times with some other people in a similar size facility in a similar region with similar salaries, etc., were paying 1/6 or 1/7. Yeah, then we knew that client, we knew how they operated without breaking any confidences. We could also compare them to other facilities who were clients on some of the business decisions to get them to think differently, to actually focus on it ahead of what we knew the state budget. In our conversations, the state couldn't continue to afford just unlimited increases.
Very much like Mike just said, clients would sit down and they would look at it. First thing they'd want to know is who is this median? Which provider is that? And you wouldn't talk about it, but after a while, after several years, they figured out who was who. But they would use it to, I'll say, look at their own operations inward, look at where they were high, and if they were high in nursing and they're still getting paid for it, it was fine. But if they were high in G&A or some of the other more cost-sensitive areas, they would start looking at it, focusing at it. I think probably 3, 4, 5 years into the cost comparisons, I think that our clients that were in a growth mode were using it to benchmark acquisition targets.
One of the things I recall, if you remember during the nursing shortages that we've had over the years, there was nursing pools spraying up all over. And one of the things people would look at on these cost comparisons is how their pool usage was compared to others too, because virtually everybody was using pool. And I think the state of Minnesota probably frowned on it because it was probably higher cost nursing because it was external rather than hired. And we were picking up on that trend early on, if you recall, seeing a whole bunch of nursing pool usage, and they were springing up all over the place. And I'd say in the early years, when we were doing these cost comparisons, we were looking at really inflationary changes in a cost-based system, transitioning to a non-cost-based system. Now when we look at the cost comparison, we are looking at not just cost changes from an inflationary percentage, but we're looking at acuity-based changes and what that's doing to drive cost changes. It's way more focused on acuity than it is on what's the inflationary cost increase. That's almost a non-discussion item.
This also got us in some credibility in the not-for-profit world, which was where most of our growth came from 83 on. And they were the ones who were having audits done because they had bond issues. And again, that led into the feasibility studies, which most of our for-profit clients were developing. They didn't need a feasibility study. They'd go get a bank loan.
It's amazing the transition that's occurred over the years. We're talking about how it used to benefit our clients, you know, how we'd use the data to help them. And since that time, over the years, it's really been used legislatively. It's been used politically, comparatively, because if the stats begin to show that costs aren't changing or costs aren't keeping up or revenue's not keeping up with costs, you name it, all kinds of things began to be determined from the cost comparison. It grew from something that was very focused and very specifically focused and helpful to something that's really grown into something large. And for us, we use it as a marketing tool on our website, and we also use it just for marketing efforts in general. Clients will still call and say, where can I get that cost comparison? Where is it?
The healthcare reform, however, brings a whole different set of requirements on providers. Frankly, it brings a different set of requirements on each of us as consumers. As consumers, it matters to us what it costs, and it matters to us what the quality is, or at least we're beginning to pay attention to it. And this is a framework that's essential, not only for our clients, but for us to operate in this realm.